I have a history where I worked for several years as a crisis management consultant and a behavior analyst. So there are things that I haven't abandoned, things that I took with me that I feel are still applicable. So despite the fact that you may be now targeting the right skills in the right context and kind of the how to facilitate teaching can be more sophisticated, pretty technological, informed by EFL, but by the most kind of current evidence in our field. You don't change behavior overnight, especially when you're supporting people who have long histories and complex histories of problem behaviors, often that have become pretty efficient. And so I recognize that the history that I have as a crisis manager has provided me with certain skills of being a good noticer of nuances and correlations of how someone interacts, through their behavior with their environment, and that even with limited information, there are things you can do to proactively be responsive and keep stable people stable, or to quickly return someone who's in what they will call pre-crisis back to de-escalate them back to stable functioning. And also I have this sense that when things escalate, despite your best efforts, that it is dangerous to improvise, that you should be competent in using the procedures that will ensure the safety of everyone involved. Now, I understand that nobody wants to be known as the restrainer, the person who leans on that, who abuses that and misuses that. And also, I recognize that when you don't train to be able to handle those situations and to self-manage and to be analytical, still wear that hat when you are using restrictive procedures or when you are acting as a crisis manager outside of strict protocols and controlled programming, you could do this with sophistication. And so instead of thinking of crisis management as other and not sophisticated and not analytical, my contention is that you need to see it with the same emphasis and importance and aim to be as competent as possible, such that you use that as part of your practice in the more in a very judicious fashion, and that you ensure then that you have the best systems in place to avoid drifting from best practices in crisis management. So I think that using EFL and using crisis management are complementary, and now to my next point, and what I feel could be also integrated, is the practical functional assessment and skill-based treatment. The practical functional assessment and skill-based treatment, it has also kind of changed the status quo in terms of how we assess and we treat severe problem behavior. There are things that I gravitate towards from the proponents of the PFA SBT, and one of them is this value or this disposition to be trauma assumed. And the way I see it is when you think of the SBT tree that a lot of people are now familiar with. The SBT tree is great in kind of picturing the sequence and priorities of the skill-based treatment, how communication, toleration, and cooperation is at the core of what you would prioritize. And of course, they have a very specific technology and progression to teach those skills, and then their branches, right? But in keeping with that metaphor of the tree, I often think about the roots, right? The things that are below the surface, to kind of give some weight to this position of being trauma assumed, because it tells you that there is aspects of their history that is unknown, that we have a lot of blind spots. So there are things that we gather from their history that can be useful, but if you are trauma assumed, you know that the likelihood is that they have experienced abuse, that they have perhaps experienced some specific traumatic events. And when I think about people with more limited skill repertoires, I just think about, if I put myself in their shoes, kind of the cumulative experiences where they haven't had the opportunity to really control their environment, and how that in itself is sort of a potential for trauma or for really struggle, in life, which then gives you a sensibility. And I think the way that Hanley, if hopefully I'm quoting him correctly, he says that you show concern for the learner in the moment, every moment. And so to me, it's adhering to that value, right? That if you carry that with you, this sensibility that they have likely experienced trauma, you are a lot more compassionate, you are a lot more careful and gentle. And so then the ways that they proceed with assessment and proceed with their functional analysis is designed to accomplish really having a practice that is that compassionate, that is really gonna empower that learner, that is gonna come from a place of assumed difficulty and unpredictability, struggle to be effective, to a place where their behavior reliably contacts a pretty powerful reinforcement context. And for me, honestly, the debates that occur about, the debates you hear relative to whether this is a functional analysis or not, is not what drives me to embrace this. Other people can have those debates, and I'm interested, and I'll listen to how this conversation evolves. But other than it being a single test and control condition that aims for functional control rather than functional classification, to me, I like how therapeutic it is. To me, if I were to call it something other than a functional analysis, I would say it's a stabilization procedure. And a stabilization procedure where you are ensuring that your learner is going to be reliably contacting a very reinforcement context, and that my way of justifying creating an evocative event is by quickly having the learner's behavior contact reinforcement again. And in that reliability, in that predictability, in making their behaviors successful, I think that you are both repairing a past history that we assume was traumatic. You're also, in some ways, building trust and rapport, as they would suggest. So it's like you're also re-pairing. You're now building a rapport again with that learner because you're kind of mediating that. And then it's a pretty empowering thing for the learner, and I think this is therapeutic and it's pretty disarming. So that's what makes me gravitate towards this. Yes, I'm a behavior analyst, and sure, I want to be scientific and analytical, and sure, I've valued functional analysis as as something that kind of represents us in our practice. But in this case, as a practitioner who has supported people with severe problem behavior for a good part of my career, I feel really comfortable about implementing a PFA SBT, and my views or my contention is that I do it because it's safe and it's therapeutic. It would be valuable to integrate all of these approaches, that not only you have a curriculum that really gives you guidance as far as what you should teach and why, and the conditions under which you should teach those skills, that you have a pretty safe way of stabilizing by having a pretty compassionate and controlled way to assess and treat in the early stages of that because of the complexity of all of this and the fact that nothing truly is foolproof, that you need to have a strong repertoire of skills as a crisis manager in case things do escalate. But also thinking about crisis management also offers you a way to respond when you are not running these controlled SBT sessions. That when you go back to your regular programming, to your day program, to your residential program or your family home, to your daily living routines, that when you're not contriving and controlling for this kind of careful process, can you do something that is aligned in values to that yet gives you some flexibility, and you practice loosely, and you're able to even adapt to situations that are less controlled and planned, that occur more incidentally. And that, to me, that's what, from the FTF framework, you would call universal protocols. But from my history, that's what would be informed by professional crisis management, right? Is that at its best, you are really making sure that you are optimizing moments when someone is calm and relaxed, and to do your best report building and to do your best teaching. As Vince Carbone would say, you teach when the iron is cool. And so you want to use those moments to truly use prevention, to truly take advantage of someone who's relaxed and would enjoy participating in activities that are relevant to them. So brings me back to the notion that you're choosing things that accomplish something for the learner, and you do it in the context that matter to them. So it in itself, that kind of helps you create environments that foster that cooperation. So that's the proposition, is can we find ways to, informed by different approaches, that can elevate your practices and cover perhaps some of these gaps that, when you look at the approaches in isolation, they may not be as effective. The PFA SBT is perhaps one of the most current approaches that cover almost all the bases, right? But even for those who are championing this, sometimes you run into issues, and so it's partly informed by organizations that we have collaborated with that we know are well versed both in the PFA SBT and in EFL. For example, Upstate Caring Partners in Utica, New York. They have been trained by FTF Behavioral, and they have gotten credentialed, and they have really been immersed in that. But they have also received training and consultation from us at Essential for Living. So John Horn, who oversees their adult residential program. He has kind of thinking about this with me and kind of formalizing how we conceptualize the integration of all of these approaches, and we're developing some case studies just to ground this with a little bit more evidence and more data to perhaps give credibility to the notion that the integration is worthwhile pursuing. And then also because despite the fact that they have received this training, crisis situations still occur. And those questions I've asked about needing to still have a strong crisis management repertoire is relevant to that organization. It's relevant to John Horn as a colleague who, again, if you meet him, brilliant and the most compassionate man, but he recognizes, this is a part of what we need to know. And we have talked about this several times, and some of our concerns, for example, have to do with how people who are contacting information through the media, for example, these days may find their way to conversations about the PFA SBT, for example, and the rhetoric around how it belongs to today's ABA or to compassionate ABA, and taking some of the rhetoric from its proponents, and then inevitably there is some hyperbole, right? And so you would hear things like, I won't work for a company that will expect me to restrain children. And something like, instead, I will work for a company that employs, your fill in the blank compassionate ABA, fill in the blank, so hyphenated ABA. What I'm trying to help people rethink is that you can use crisis management and still be trauma informed and trauma assumed and compassionate. That you would be aligned with these approaches if you ensure that the best crisis management repertoires are in your scope of competence, that you have systems that would avoid you from drifting from the recommendations of that crisis management system, and that you are also using the better practices in treatment. And part of that is knowing some of these approaches well, but then also knowing how they integrate. So to me, it's a combination. It's in the integration, and it is in the synthesis that you are best equipped to serve a population that has complex histories. And you're starting from a point of very limited repertoires, accompanied by pretty severe problem behavior. And so the way you navigate all that requires for you to have all of these different skill sets. And so my bias is that if you cover all of your bases, then if you need to use restrictive procedures, you will use them judiciously, but also you won't lean on them, or you won't permit the overuse of those things unnecessarily. And often with some learners, you may not need to use restrictive procedures at all. So if you think that maybe by ignoring or putting aside crisis management, then you think that you're doing the right thing. But if you are there with a responsibility to serve individuals who engage in severe problem behavior, there will be a time where even being perfectly trained in the PFA SBT, you're going to run into situations where things escalate, and you end up improvising, and you end up probably making horrible mistakes in those contexts. One thought I had when I was thinking about the value of televisability was that I like how creative and how how smart it was for them to help us kind of view ourselves and view our practices and question them by using that that exercise of visualizing how that would look in the evening news, and it is true that if you saw some of the things that people do, some of the procedures that they rely on, that it would be cringy to see that in the news. You might feel embarrassed or afraid, or it might bring you a lot of negative feelings, as well as if you are using some of these compassionate approaches, you might feel a lot. You will feel proud of your work and more at ease. And if you saw that in the news, then you can stand by that. But to me, that specific example is like a snapshot of a moment. Even when someone appears in the news and is questioned and is scrutinized, I still keep thinking that in some cases it's someone who made a terrible mistake in a very difficult situation. Or it may represent like some ongoing practices that are very questionable. Those could be true, both could be true. But I like the idea of thinking about a documentary, something that is more long form, that shows you all the ups and downs of treatment, that really paints the full picture of what people go through. And then you realize that even those who are championing the PFA, SBT, and EFL and other great curricula and approaches and technologies, that it's not a linear process and it's not a foolproof process, and that often what you see is people having to refine and troubleshoot, and that when supporting people who have histories of severe problem behavior, even for those who are championing the best practices, you would see moments of escalation, and you would be okay if you see the entire process, even when things escalate and people have to respond in ways that keep everyone safe, that it won't cause the same outrage, that you would still be interpreting this professional, like your interpretation of these professionals is that they're still compassionate. The issue is when you think that moment in the evening news represents them and everything they do in their practice. So I can see how this can become also inflammatory and misguided, you know? When I think about whether it is a misconception or a reality that crisis management is not aligned with compassionate approaches, I say it's both. It's both a reality and it is a misconception. And we have to recognize that people do drift and people do sometimes implement crisis management poorly. But then also at its best, when people use crisis management judiciously, they can do it in very compassionate ways. Some of my biases are kind of is trying to prompt the conversation that we need to look at crisis management differently. Now, when it comes to EFL and SBT, I've been thinking about the ways in which they could integrate, and when does it make more sense to think about, do we need to reconcile aspects of how we practice one thing or another? And Um, with EFL, something that is very clear, and you could ask this to Greg Hanley or to Pat McGreevy, and they would agree, is that the skills that are prioritized are coincide, they overlap, right? So what we would call our necessary 9, our must-have skills align with what the SBT prioritizes as well. So the what we teach is very much aligned. When you get to the branches and to the branch extensions in the SBT, I think that EFL is well suited to inform what those branches should be for learners with more limited skill repertoires. And what it may prompt us to do sooner than later is to teach in context. And what the SBT sequence, the progression usually recommends, is a little bit more conservative, right? Like, they are very careful about not risking going backwards and not risking evoking problem behavior. So it would take longer for them to get to this generalization context. And so my question is, with some learners, can you take that risk earlier? Can knowing that it is crucial for them to learn in context, would you consider then teaching in the generalization context a little bit sooner, and still be mindful about not evoking problem behavior? And I think it is possible. Some of the things that the SBT would recommend with regard to prompting. These days, they would encourage you to show the contingency instead, and so basically they model contingencies instead of what we would often recommend with EFL, which is using simultaneous prompting or errorless prompting. The recommendation comes from thinking that sometimes our physical prompts would be evocative, right? That would cause escalation, and that's often true. And so in that case, then what they have reliably done, and they're confident about, is that if you do enough trials showing the contingency, the learner eventually exhibits the response. Whether this is, this is often at the place of teaching a toleration response, or a communication response. And while EFL might suggest to do an errorless prompt, if in your estimation this would cause problems, we wouldn't have any problem with leaning with the alternative, right? With what the SBT process would recommend. But that's not always a reasonable assumption. Some people do tolerate physical prompts, and when you are using some of these errorless prompts, you are also coming from a similar place where you are getting the person to contact the contingency, you are reducing effort, you're reducing delay to access to reinforcement, you are concerned about those windows where nothing happens. So you're trying to accomplish the same thing, right? Is to minimize or mitigate chances for problem behavior to occur, and for the prompted response, the skill to contact reinforcement. And so you could go either way, and so here basically you would need to kind of assess that. Would this learner escalate if physically prompted or not? And perhaps then there's still room, even if you're running an SBT, to use an errorless prompt rather than to show the contingency. So these are the moments, for example, where you might flex some of what you're implementing, and there are other things in the process that I see could be integrated. For example, when you use the tree metaphor and you look at branches, what I have heard Dr. Hanley say is that over time, those branches get thicker, and meaning that you extend them in some ways, and then you increase the expectations and some of the stamina of the learner within that task, or some of their participation and the complexity of that. But the way I see branches when I think event-based teaching is that those branches are intertwined. So the notion, as I was explaining earlier, that if you find relevant events that occur routinely and repeatedly over the course of days and weeks, then within those events you're teaching multiple skills that are required there, that are relevant and functional. So instead of thinking, now I'm teaching academics, and then I'm teaching leisure, and then I'm teaching communication, then I'm thinking there could be relevant events where I'm teaching communication and academics and leisure, and some of those skills that we had at the trunk of the tree, or some of the must-have skills in EFL, because you continue building on being able to wait and being able to take turns and share and accept no, even when you arrive to those branches. So you continue working on those skills while you also mixing and stacking other skills within events of relevance. So I don't know that the SBT prompts the practitioner to think or conceptualize in this way. And so I hope that as we continue talking with the leaders of this process, and they learn about EFL, and really kind of dive deep into it, that they realize that this notion of teaching within events and stacking skills makes sense. And then if we can accomplish being safe in the process, right, where when we convince those who are informing the SBT and how that evolves, if we can convince them that we can teach in these intertwined branches and not take us backwards in terms of what we already built in terms of safety, if we count on learners that get to a point that they're resilient enough that despite experiencing not exact HRE, but maybe you are now experiencing life like we all do, with moments of unexpected things occurring, and perhaps moments of frustration and disappointment, that you're still free from problem behavior, that you can cope with those things, but then you also have skills that help you be successful even in difficult circumstances, even when reinforcement is thin, even when things don't go your way. And you're also doing it, practicing multiple skills that are relevant to certain circumstances. So I think that's probably where things might evolve. And I think that EFL already has a sensibility of still being systematic about teaching multiple skills within a single event. I think that needs to evolve for us, how we train people to design those events and to be able to track multiple things at once, and to maybe convince people who have a very detailed technology like the SBT to think that this could morph into something that looks that way, and it won't be loosey-goosey. It can still be pretty systematic and technological, and yet when you hear the conversations about efficacy versus effectiveness, when you think about ecological relevance, that's the next frontier, right? Like my concern sometimes is with achieving all of, kind of graduating from this SBT process and still not being confident that they will be able to navigate life as it occurs for most of us successfully. Because there's still some aspects of the arrangement that are a little bit artificial. And so yes, you count on maybe having a new history that was a lot more empowering, building skills that prepare you for life. And I think that's accomplished, but I think that can be pushed even further. And I think that part of the way EFL is evolving can inform how the SBT evolves as well. And of course, the entire soapbox about crisis management to me has to do with if we are committing to supporting certain populations of people with profound disabilities, we as these processes and procedures evolve, we're still gonna find ourselves in need to have a good crisis management skill set. And that's what my history tells me. And sometimes I'm afraid of how practitioners deal with those moments where things are difficult and stressful and dangerous. And so we need to prepare professionals for that. So anyway, I think that sums it up. Like there are many opportunities here for these approaches to be integrated. And so I find that interesting as a project for me to continue building on this and for it to perhaps evolve how our training programs in EFL kind of beginning to formalize that and to disseminate this. But I know that this is going to continue evolving.